Good morning. This is Assemblywoman Petrie-Norris. Thank you so much for joining us for this Facebook event. Today, we are talking about going back to school in the midst of COVID-19. And with so many of our Orange County schools deciding if and when and how to return to in-person instruction, this conversation feels particularly timely. Really pleased to be able to be joined by three terrific panelists today. We are welcoming Dr. Michael Weiss from CHOC Children's Hospital. Thank you so much, Dr. Weiss. We are also welcoming Dr. Alicia Smith Aryaga, who is the Executive Director at the Education Trust West. Thank you, Dr. Aryaga, for being here. And we're also welcoming Dr. Jeff Hittenberger, who is the Chief Academic Officer at the Orange County Department of Education. Thank you all for joining us for this really important conversation. Can you just, before we jump into the questions, can you take a minute to introduce yourself to the folks who are joining us at home? Let's go ahead. Dr. Weiss, we'll start with you.
Great. Thank you very much, Assemblywoman. It's very, very nice to be here, and obviously a very appropriate topic for where we are in the community today. I'm Mike Weiss. I'm a general pediatrician. I practiced in the Rancho Santa Margarita area for about 25 years. I've been at CHOC Children's now for 6 years, and I'm the Vice President of Population Health. I have the good fortune to work with a number of very talented people on our relationship with our schools, on preventative health care, and on really helping the community to stay healthy. So thank you very much for having us.
Wonderful. And Dr. Aryaga.
Well, thanks so much again for having me today. And I'm Dr. Alicia Smith Aryaga, Executive Director of the Education Trust West. And Ed Trust West is an educational justice organization, and we're really focused on making sure that data gets into the hands of parents, students, and communities across the state to make well-informed decisions about education. And at Ed Trust West, where I've been about 3 years, I'm both a researcher by training and have done a lot of advocacy work. And we really have observed, that whether it's quality early education or the most experienced teachers, advanced coursework, or college opportunity, we give the least access as a state to the students who need it most. So the students of color and low income students, and the results before the pandemic were really predictable. And we think we really have an opportunity to do something different post-pandemic. So super excited to join the conversation today and talk a little bit about that.
Great. We are excited to have you. And Dr. Hittenberger, thank you for being here.
Thank you so much. It's an honor to be a part of this panel. I do work as Chief Academic Officer at the Orange County Department of Education. I work with our Orange County Superintendent of Schools, Dr. Al Mijares. And we serve the 27 school districts in Orange County, serving about 500,000 students. So this topic is something we're thinking a lot about these days.
Right. I would certainly imagine so. So I feel like, multiple times a day, I use the phrase that we're in the midst of an unprecedented crisis, but really and truly we are. And while educators have faced challenging times in the past, there's really been nothing like the COVID-19 outbreak that in the spring shuttered campuses across Orange County, across the state of California, and really all over the world. So I would just love to start us out, if you can each kind of give your perspective on the challenges that you are facing right now as educators. And Dr. Hittenberger, we'll start with you.
Well, thank you. And you've described that very accurately. I think it's an unprecedented, historic kind of moment for our education system in Orange County. Again, just the scale of 27 districts, 600 plus schools, 20,000 plus teachers, 500,000 plus students, and to try and essentially overnight shift from an in-person mode to an online distance learning mode, that's just, it's almost a mind-boggling kind of scenario. And I have to really start by commending the courage of everybody who's been involved in this process. Because to face that kind of challenge as a parent as a teacher, as a support staff member, a community member supporting and working with schools and the children, the students themselves, to come through these last 6 months and sustain learning in those circumstances has taken a great deal of courage and creativity. But every day is a major challenge.
And Dr. Weiss, to your perspective on the really profound challenges that are facing educators
there are
right
obviously
now.
many challenges. I think, as a scientist, as a physician, probably one of the major challenges is the speed and variability of information that is coming in. I'm sure one of the frustrations of parents, of the scientific community, is the ever-changing environment, the ever-changing recommendations, and trying to sift through the actual validity of what's out there. So that's a challenge, because we are obviously focused on the evidence base, CDC, American Academy of Pediatrics, California Department of Public Health, Orange County Healthcare Agency, et cetera. And tracking on that is important. Two other quick challenges, I think. First is the mental health aspect of this. And I know we'll talk about that a little bit later, but we have never seen this type of an issue affect the youth and young adults of a county like this. And many know we've had a rise in teen suicide, and we're just seeing some tremendous mental health issues that are going to be occurring long past this epidemic. And then lastly, the disparities. And I know Dr. Aryaga will speak about this, but the broadening of the disparities related to the social determinants of health. This has really shed tremendous light on the differences in the ability to engage based upon those social differences. And
Dr. Aryaga, your big picture perspective on the challenges that we're facing right now.
So the last 6 months have definitely been challenging, whether you're a parent, which I am, of a 6-year-old in Oakland Unified, whether you're a teacher or a student or a principal or an education equity advocate. The last 6 months have brought about uncertainty and fear about the future and our students. But at Trust West, as I mentioned before, we really are challenging ourselves and decision makers to turn this crisis into an opportunity. And unequivocally, we need to follow the guidance from state and local public health experts on when and how to open schools for in-person learning. And one of the challenges, though, that we've seen is that what we believe is the key to success and really creating opportunity is involving families in that decision-making. So from instructional models to decisions on distance learning to hybrid models or full-time in-person. Right now, we know that most districts are doing online instruction, and we would really like to see local districts work closely with families to make sure that students have devices, which has also been a huge challenge on a 1-to-1 ratio. And we also have surveyed parents across the state. We did a poll earlier a few months ago. And one of the big things, just to reiterate, again, as Dr. Weiss said, that we heard from parents is that parents really wanted districts to prioritize the social emotional wellness of students. In that statewide poll, about half of parents reported higher than usual stress levels for their children. And then 80% of parents said that their own stress was elevated. And we know that children feel that stress too. 91% of parents said that they would benefit from more contact with school counselors. So these are some really daunting statistics, but our kids are also resilient. And with our love and support and creativity, California students and our whole state can really emerge from this moment stronger than ever.
Now, Dr. Weiss, I want to come back to you because you mentioned that one of the real challenges that that we all are confronting is that there's kind of this ever-changing environment, ever-changing recommendations. We are learning new information every day about this disease and the risks that it poses, particularly for our children. So I want to start with a couple of questions just to bring everybody up to speed on our current understanding of the health risks, particularly as it pertains to our students. So what do we know right now about kids and COVID-19?
So it's an interesting phenomenon because I think, everybody's pretty well aware that COVID-19 has selectively not affected children as severely as it has adults. And we don't really know why. There are a lot of theories around that, perhaps some halo effect from immunization, how the immune system functions, et cetera. But we know that for the most part, children do not get the disease as frequently or as severely. Now, with that said, much like adults, if the child has underlying pre-existing conditions, such as heart disease, lung disease, diabetes, and immune deficiency, we know obesity is another very high risk for contracting the disease. We know that can be an issue. What's really interesting, though, is that children have also, and it's fairly well reported in the literature, can and very often are asymptomatic carriers. And that's a very important component because if a child is not showing symptoms, they could still be presenting the disease to adults or other children. And that's part of the challenge around how aggressive to be at schools and things like that. And then lastly, a very rare but very serious complication that's being seen in children, this multisystemic inflammatory syndrome of children. Big, long word, but essentially it's a post-inflammatory, it's a post-disease situation where the immune system gets cranked up and organs of the body are attacked by the body. And we've seen a few of those cases here in Orange County, a number of them across the country. Thank goodness, very rare, but obviously extremely, extremely dangerous.
So while children are less vulnerable, we're certainly seeing that they're not immune, and as you said, they can be carriers, even asymptomatic carriers. And what is our latest understanding about the transmission risk? Because I know it feels like a few months ago I was reading some research that suggested that actually children pose less of a transmission risk than adults. What's our best understanding right now?
I'm going to give you an answer that probably won't be a whole lot of help because the literature is kind of all over the place on that one. I wish I could give you a more definitive answer. There are some studies that have shown higher transmission rates than others, but we do know that masking is a benefit. And I know Dr. Hittenberger is going to hit on this in a little while, but we strongly continue to recommend masking in the appropriate age groups, which I'm sure we'll talk about.
Okay. So certainly we are trying to navigate significant public health risk when we talk about, if, how, and when to reopen our schools. But of course, we also recognize that there are significant developmental risks, and as you said, mental health risks and negative consequences to having children, on this in virtual learning from home. Can both of you, Dr. Aryaga and Dr. Hittenberger, just speak to why is it so critical for children to have in-person learning and to be in the classroom? And Dr. Hittenberger, we'll start with you.
Thank you. Yeah, one of the things that this whole crisis reminded us of is education is first and foremost about our humanity. That is, it's not primarily about learning a set of skills, which can be done in a number of modalities. But at the heart of education is a set of relationships. It's a relationship between a student and a teacher, between a family and a school community, between community support system people and the families and children at that school. And to a certain extent, those relationships can be sustained and built through our technology tools, but it can never replace the embodied three-dimensional experience of actual in-person connection. And, our folks have done an incredible job of sustaining learning and sustaining relationships in an environment where all you have is access to two-dimensional connections. But ultimately, we want to be in a place where we're in that personal, connected, embodied experience. And I think that's what everybody is working toward and why we need to get a handle and sustain our precautionary measures, including face coverings, including frequent hand washing, including physical distancing, so that that in-person experience can be available to us.
And Dr. Aryaga, what are you seeing on the ground right now?
So we're seeing, as I mentioned earlier, that most schools are continuing to provide instruction, which we're glad the students have the capability to receive. However, even though California is a global center for the tech industry, the digital divide persists, and it's more evident at schools and districts and colleges across the state as we grapple with COVID-19. So in a recent study from Common Sense Media, for instance, that study revealed that 25% of California's K-12 students lack adequate internet connection and 17% lack adequate devices. And actually 8% of teachers actually lack adequate devices or internet access. And so until, as a state, we're really able to solve the inequitable access to technology issues, and also the lack of support for educators to teach via an online medium, and the lack of resources for families to support their children's education digitally, we really amplified some of these issues, given that we are virtual. We did hear from parents in the poll that we conducted too, that 38% of families that were low income and 29% of families that were of color were really concerned about reliable internet access and distance learning when it came to being able to provide online instruction to their students as well.
If I may add one comment.
Yeah.
I think it's also, a lot of people don't consider this, but children with special health care needs are really not as equipped to do remote learning at home. And the other thing that people may not realize is the two concepts. One is the free and reduced meals. So a lot of kids, their only meals are at school. And secondly is a lot of these kids are getting physical, occupational, speech therapy through their individualized education programs. And if they're not at school and able to do that, it creates more of a gap.
Well, I think what we've seen and what this moment has certainly illuminated is the fact that schools serve a role in so many kids' lives that goes well beyond just education, right? It's basic needs. It's their, it's the best meals that they get every day. It's recreation. It's physical and mental health. It's, for many families, it's basic childcare. And I think, for that and for all of the reasons that you all spoke to, I think, many leading experts have said that it's, they're advocating for a return to in-person learning, provided that it can be done safely, right? And that feels, to me, that feels like it's the multi-billion-dollar question right now is, okay, we know that, even though we've made really great strides with online learning over the course of this summer, and so many of our teachers are coming at this with really creative and innovative solutions, we still know that all things being equal, it's better for our kids to be able to be in a classroom setting. So how do we do that safely? Like I said, it feels like it's a $100 billion question. And again, our knowledge is still evolving, but I'd just love to bring everybody kind of up to speed on best practices and what we know right now. So Dr. Weiss, I'll start with you. What criteria are public health officials using to determine whether it's safe for schools in a community to reopen?
Yeah, so I think people are pretty familiar with the tiering system, and that's really focused on case rates and percent positivity rates. So that's kind of a gating item. Any community where we know there's a rapid rise or a cluster of cases, it's probably not a good idea to be thinking about, opening schools. But aside from that, we know, regardless of the evidence base that you read, there are 5 or 6 or 7 domains that we need to really kind of check the box on. And UC Irvine, CHOC, and the Orange County Healthcare Agency, along with OCDE, have created a kind of a template where schools can kind of send in, here's what we're thinking. What do you guys think? Are we good to go? And we're not giving them the approval, but we're saying, yeah, you got this, and maybe you missed that. But first and foremost is there has to be a team. So there has to be an organized approach at a school whereby people know their roles and they know what to be doing when things arise. There has to be a plan for if a child is sick. It can't be a fire drill where people are running around, oh my God, Billy has a fever. And I'll share with you later, if we have time, our student symptom decision tree, which has been a huge success in the county. There has to be a plan around spacing of kids, masking for the kids. There has to be a plan around cleaning, appropriate cleaning of the classrooms, of playground equipment. There has to be a plan around transportation. So I know the parents on the line are, I'm sure, aware of staggering of starts, staggering of school days, and then cohorting, which I know we may talk about a little bit later, but having groups of kids who stay together with a specific teacher, which gives us a better opportunity to track on things. Those are just some of the domains that we're looking at to make sure that people are checking the boxes.
Okay, and so all Orange County schools have submitted their plans to that group for review and evaluation.
It's actually an option. They are not required to send that to us, but we've had a number who have taken advantage of it, and we have a lot of dialogue between the schools regarding those domains. Okay,
and remind me, and because you said so, it's CHOC, UCI, some folks from the county, but what is the name of that review body or the review or consultation body?
We euphemistically are known as 1844-GET-CHOC. So for a school to access us, or for that matter, any parents to access us, we have a 24/7 line that's available, 1844-GET-CHOC, C-H-O-C, where we have a nurse who's available 24/7 to answer COVID-related questions on kids. And if necessary, we can actually transition that to an immediate telehealth visit for free with a physician or nurse practitioner from CHOC who will offer advice. If it's a school that's calling, we can triage that to create an education program or a review of a back to school plan on a schedule as well. Or our practitioner can speak to a school official to help them with a specific problem that's occurring right now.
Okay, that's tremendous. And I think all across the county, we've just seen the ways in which individuals and organizations have just been stepping up to help our community navigate this crisis. So CHOC's leadership has just been really tremendous. So thank you for that. Dr. Hittenberger, give us just an update. Where are Orange County schools right now? How many schools are actually open for in-person instruction in the county today?
Yeah, let me follow up just a little bit on Dr. Weiss's comment, and then I'll get to the current status of things. Dr. Weiss was a critical part of an effort that brought together all 27 school districts, the Orange County Department of Education, the Orange County Healthcare Agency. We built on the foundation of the California Department of Public Health guidance, which is excellent and really speaks to all of the issues that we've talked about so far. And then that collaborative group translated that guidance into Orange County specific guidance. So I believe your team's going to put links to both of those documents, the CDPH document and the Orange County Together document in the chat area. So our participants today have access to those full documents. We can provide brief summaries, but there you have the in-depth information that every district in Orange County has then used to create detailed safety health plans, not only for the district as a whole, but for each individual site. And there are actually checklists that if you're going to open a site, that checklist has to be complete, addressing every element that's in those guidance document, and then has an attestation signed by the superintendent and the principal that then actually physically goes up on that site so that the community can see, okay, they've covered this, and this. So every district in the county has been developing and put in place those safety plans based on the guidance. As of last week, we had 8 districts that had begun phasing in a resumption of in-person instruction. So 8 last week, I think there are another 3 to 5 this week that are beginning to phase in-person instruction. And as you have probably seen in the news, that's not everybody comes back the same day and
Right.
we're all back. It's a phased in model. It's a hybrid model. It generally differs depending on the age level, with younger kids tending to start earlier and, you know, later grades starting later. So the districts have time to put protocols in place and create the physical distancing. And the safety folks are going with teachers classroom by classroom, making sure that those classrooms are laid out in that physically distanced way, in some cases with plexiglass dividers, that you have hand washing stations quickly available to any student. And then superintendents are working closely with the Orange County Healthcare Agency, and they get weekly zip code levels of positivity rates and case rates for every zip code that they serve, and then can make judgments on what the appropriate phase in of in-person instruction is based on not just countywide numbers, but
Right.
zip code specific numbers. That's where we are.
Okay. And so in addition to I think you said 8 districts that have reopened and then 3 others that are considering, we also, since the beginning of the school year, there's been a number of schools across the county who received the elementary school waiver from the Orange County Public Health Department at that time. And I believe it's something like 150 schools that had opened, though, you know, with the understanding that most of those are private and very small schools. Have there been, to your knowledge, have there been outbreaks at those schools over the course of the last few weeks where we've been in, when they've had in-person instruction?
Not to my knowledge. I know that superintendents and principals are working very closely with the Orange County Healthcare Agency, and part of the protocol is if you have a positive case, you report that to the Orange County Healthcare Agency. Okay. But I have not heard any reports of outbreaks. I know there have been individual cases where perhaps a staff member or somebody at the school has tested positive, but I haven't heard of any outbreaks since the resumption of in-person instruction.
Which is good news. And I see, Dr. Weiss, I see you also shaking your head. So, you know, it's been a few weeks, smaller schools, but I think my hope has been that the lessons that we've learned with some of these initial openings in some of these smaller sites will translate into best practices that then can be implemented as we look at opening larger institutions. So, Dr. Weiss, just give us kind of an overview. What are the best practices? What are the most important precautions? You talked about kind of the planning that goes into it, but, you know, in practical terms, what should parents expect as they send their kids back to school?
Yeah, I mean, I think what we've learned, and we've had an opportunity to learn from some other countries that were a little bit ahead of us, particularly 2 that we contrast. One was Israel, which went back to school a little bit earlier than we would have probably hoped. And they did see a nice spike in cases in Israel. And if you contrast that to Sweden and Denmark, that were more conservative and were very adamant about masking and spacing and some of the recommendations that I mentioned earlier, they actually were able to maintain lower levels. So we are learning. I will share with you that we are also in Orange County in the midst of a study to do exactly what you just identified, Assemblywoman, which is what are the best practices. So in partnership with UCI and the OCDE and the Orange County Healthcare Agency, we have 4 schools that we are working with where we are looking at what are the measures they are each implementing. And we're actually doing questionnaires, and we're doing testing of students and staff to determine what rates of cases we see, and we'll be able to identify, based upon what they have implemented, those best practices. Because I think we all agree this is something we're going to be dealing with for a number of months, and if we can in the next 4 to 6 months say, if you do A, B, C, and D, we know those are best practices, it's going to lower your rate of transmission, we can then implement that more broadly.
And so, Dr. Hittenberger, so kids, we talked about masking. Is the recommendation that all students should be wearing masks, or what is the official Orange County Department of Education recommendation?
The requirement from the California Department of Public Health is that all kids wear masks above 2nd grade. and that it's strongly recommended for second grade and below. And many districts are including face coverings for the younger children as well. We sometimes go to the San Diego Zoo and see little tiny ones with face masks on all day long. So it is possible, and it's what is the most effective means of stopping the spread. So we want to make sure that every student possibly, and staff member as well, is wearing a face covering, maintaining physical distancing, staying in cohorts, all the things that Dr. Weiss has mentioned.
Well, and I think sometimes we think that, oh my God, little kids, getting them to wear a mask, it seems like such a big deal. But actually, little kids are like, they're flexible. And I think, as you said, Dr. Aryaga, they're resilient. And if we tell them that this is a horrible thing to do, they're not going to want to do it. If we say, hey, I'm putting on my Superman mask today, or I'm putting on my Wonder Woman mask, then you're a superhero for the day. So it's so cute when you see the little kids walking around with their little masks on. And I just want to pick up a little bit more on the subject of cohorts. So Dr. Weiss, explain to us, what are cohorts and why are those important, and what role are they going to play in enabling us to be safe at school?
Yeah, cohorts are groups of kids and teachers who will stay together for all activities. So that includes classroom instruction, recess, meals, and even transportation as much as is feasible. And the recommendation in Orange County, and I believe, Dr. Hittenberger, you can correct me, but I think it's a California Department of Education, is 14 students to 2 educators. If the class is children under 5 years of age, the educators can be overseeing 2 cohorts. If the kids are over 5 years of age, the recommendation is 1 cohort. And the idea there is really common sense, which is if, God forbid, something were to happen in that cohort is a limited group of people that you can kind of have a rope around to be able to know what's going on and limit any further spread. You can imagine, in an elementary school, if we did not do that, and the ping pong effect that would occur throughout a school. So it is pretty well studied and definitely recommended at those ratios.
Okay. And you had mentioned, this might be a good time to talk about this. You had mentioned the student symptom decision tree.
Yes.
Is that something you can walk us through now?
Yeah, if it's okay, I will share my screen with your
perfect
constituents here, and just give me the thumbs up that you can see it.
Yeah, you can see it.
Okay. So this is something, you talked about the collaboration throughout the county. This is something we're extremely, extremely proud of. And actually, I just got word today, it was published in the American Journal of Pediatrics today. And this is work that was done with the healthcare agency, with UCI. I give a lot of credit to Dr. Dan Cooper at UCI, and actually some of our school nurses, Michelle DeHaven in particular. I'm going to throw a shout out to her. And basically, this document has probably been the most popular document across the county because this is really the what do I do at the point of care when something happens document. And I'm not going to walk you through every piece of it, but essentially, if a child presents with any of these symptoms, and we've categorized them based on the evidence base as low risk or high risk, based on that, was there a known exposure? And I think this is an important point because the word exposure is sometimes used broadly, but the true definition of an exposure is that someone was exposed to a positive patient for more than 15 minutes, and that's 15 minutes cumulative in a 24-hour period, and that's with or without a mask. So that's changed a little bit over the last 6 months, but that's the current comment regarding exposure. And then based upon that exposure, was there an exposure? No. Was there an exposure? Yes. And if there was not a known exposure, how many symptoms are there? Was there testing done, et cetera, et cetera. So I think it's beyond the scope here for me to walk you through the specifics, but this document has been made available to all of the Orange County Department of Education. Our pediatricians in Orange County have seen this through the American Academy of Pediatrics. and we have it available through CHOC and UCI.
Great. That's terrific. So just trying to keep it as easy as possible, for our parents and our teachers and our administrators to understand.
Exactly.
We talk about what to do when you have exposure to someone who's COVID positive. So I want to talk a little bit about testing and the role that you envision testing playing on our school campuses. So I know some private schools have announced that they're going to test everybody every week. Again, what are best practices and what are their recommendations for school sites right now?
Yeah, there's a lot of variable data on that as well. And obviously it's not just about, do we want to test? I mean, if we were in an ideal world, we would want to test as many people as frequently as we could. The challenge with that is obviously the economics of it. And realizing, what people have to understand is if I have no symptoms and you test me at 9 o'clock this morning and I test negative, that doesn't mean I can't be positive at noon tomorrow, right? And so what's the feasibility of testing that frequently and really getting an accurate outcome from that? So really what we have to do is we have to test wisely and we have to use our resources appropriately, and we have to test where we potentially are seeing some outbreaks. We have to test related to the tracing of outbreaks, and we have to test where we think those tests are going to have a positive impact on prevention of spread of the disease. So right now, ideally, I think if we, again, have the resources, we would love to test everybody once a week, right? But those resources are not available. So for right now, I think we're reverting to the Orange County Department of Education, the California Department of Education, and the CDC's recommendations.
And Dr. Hittenberger, what are your recommendations for Orange County schools and Orange County parents in terms of testing?
Ultimately, the testing plan for a district is decided at the district level and by their own boards of education. It varies throughout the county, but superintendents, as I mentioned, are in regular contact with the Orange County Healthcare Agency and with the Orange County Department of Education. I have to give a huge shout out to our superintendents and leadership teams in our districts in Orange County. I think parents would be proud of the way their leadership teams have addressed these complex issues, and they're integrating the California Department of Public Health. The California Department of Public Health does not require testing for all staff members and students. Those are recommendations, but there's not a requirement that take place, and districts are taking various approaches. As Dr. Weiss mentioned, there are considerations in terms of frequency, and the real focus is on putting the procedures in place and the protocols in place that will prevent spread. If you relied on testing to do that, it would not serve you well, because testing doesn't prevent spread. It's actually putting the protocols of face covering, physical distancing, frequent hand washing, cohorting. Those are the things that prevent spread. Testing gives you information about a particular case, and that certainly is valuable, especially where symptoms exist, and if somebody tests positive, we have a series of protocols that Dr. Weiss showed at the bottom of that graphic that he sent. But it's actually putting the protocols in place that prevent the spread.
And I actually think that's an excellent point, and an excellent area of focus. I do, though, for folks at home, I want people to be aware that there are free drive-through testing sites at 2 Orange County, and we're calling them super sites. So the Orange County Fairgrounds and at the Anaheim Convention Center. And so we are encouraging anyone who's, certainly if you've got any symptoms, you need to go get tested. And if you've been exposed to someone who has tested positive for COVID-19, even if you're asymptomatic, you should also go get tested. And we, over the course of the last several months, a really Herculean effort has been underway all across the state and here in Orange County in order to ramp up our testing capacity so that we can actually test anyone and everyone who needs it. And those tests are free, and the turnaround is right now at 48 hours. So if you need to get tested and you need more information, I think the easiest way is just you Google Orange County Testing Super Site, and you can make an appointment. You can make an appointment online or on the phone for you or for your child. So I now want to pivot a little bit. So we've talked a lot about the real challenges that we're facing as a result of this unprecedented pandemic, and about some of the best practices around how to reopen schools safely. I want to pick up, Dr. Aryaga, on something that you said at the very opening. You said, you're looking for how do we turn this crisis into an opportunity. And I think certainly what we have seen over the course of the last several months, COVID-19 has both illuminated and also exacerbated some of the fundamental inequities that exist in our education system. So I'd like to spend the last bit of our conversation talking about how do we start to close some of those gaps. So I guess, first question for you is, how do we start to close some of the gaps between well-funded schools, those schools that are well-funded, and those schools that aren't? And that's a challenge in terms of COVID response, and a challenge more broadly.
Yeah, well, there are a lot of things that we can be doing now, and there's some things that we need more resources to do, right? Because what we see happening and playing out across the state right now is that there are schools that have resources that are able to make sure, for instance, that students have the protection they need when they return to school, and others that do not. And also thinking about what the core tenets of equity are. So the way that we think about equity at EdTrust West is making sure that every student has exactly what they need to succeed. And what we know works to drive equity, like the research has shown, are things like small cohorts, more individualized attention. And so there are these components actually due to COVID, although it's a crisis, there are really strong equity components that we're seeing executed. And so how do we think about actually being able to do that more consistently across the state? Not only now, but in perpetuity is going to be something really, really important to consider. The other thing that's going to be important is there are about $5 billion in funds in the state budget to think about learning loss. I mean, we've talked a lot about the public health concerns, which are, of course, the top priority. And I would say that if we, go through all this effort to get students back in school, or to provide them digital learning, and then what they're getting is not quality, then we have some huge issues, because all that energy has then turned into not really mitigating the learning loss that we know that we'll see. And so one of the things that we've been trying to also think a lot about at EdTrust West are things like, for instance, in 6th through 8th grade, which are really pivotal years for math, how are we giving teachers the tools they need to, if they're either in person or online, be able to really try and eradicate some of the issues that we've had for a long time in 6th through 8th grade math. So we have a toolkit, Equitable, and we can put it in the chat, that we've been using to work with educators across the state. So teachers need tools. We need resources as a state that we're actually targeting to the students who need it most. And we need to be using things that we know work for equity, like small classroom sizes, more individualized attention, and making sure that schools and districts consistently have the resources they need to provide those things.
And we touched on, and I know we've talked over the last several months a ton about the digital divide. And I'm shocked and kind of dismayed, Dr. Aryaga, to hear that the statistic is still that we've got a 25% gap in terms of California students with connectivity and with devices. And I think we all agree, in a state that is a global technology leader like California, it's just inexcusable. It's shameful. So two questions. Well, I guess actually I'll start with you, Dr. Hittenberger. How are we doing in Orange County on that front? Because I think we're doing better than that.
Yeah, there was some research released with the Orange County indicators this past week that only 55% of lower income families in Orange County had access to broadband internet. Wow. Which is, I mean, in this day and age, given how vital the internet is not only to school, but to work and to our lives, the fact that we're still there is problematic. So as Dr. Aryaga mentioned, the last 6 months have given us an opportunity to surface issues that have been there, but we become more conscious of now. And that's certainly one of them. Our districts have done an extraordinary job about filling that gap with, our latest figures are more than 170,000 computers have been distributed to students in Orange County. 170,000, I mean, just think about that for a minute. And more than 50,000 hotspots for those families who do not have internet access. Those hotspots provide that. So our districts have done an extraordinary job gearing that up, but there are bigger, longer term solutions that we need in terms of making sure every family in Orange County has access to broadband internet. We need to work with our private sector partners, and there's been some interesting work going on in that regard. But the issues that Dr. Aryaga points out have also been significant in Orange County.
Okay. And what more do we need to do, Dr. Aryaga? We have been talking about this in earnest for 6 months. Like, what do we need to do to expedite closing that gap all across the state?
Well, one thing that we know is going to be really important, and I just can't reiterate this enough, is that we know that there are districts that are going to need more because they're serving students who have more needs. And so one of the things we're going to really need to make sure to do is to target resources based on need. So for instance, districts that are serving a lot of English learners, we know are going to need a lot more resources, and because they're going to need to provide materials in multiple languages, both for parents and students and teachers. We need to do things like make sure in areas where we were not doing a good job before the pandemic. So for instance, pre-pandemic, 80% of Black and Latinx and even a lower number of English learners were not meeting math standards. And that's not because of anything due to students, right? But we already had a huge math teacher shortage. We really we're in the process now as a state of revisiting our math curriculum framework. We really need to think about how are we making sure that students see themselves in the curriculum? How are we bringing math to life, whether it's digital or whether it's in person? And all of those things take resources, and they take resources that are targeted, especially as students who we know were struggling before.
Well, and I'll just say for folks listening at home, if in terms of an immediate need around connectivity or devices, please reach out to my office and to my district team, because we can help with closing that gap. So our number, and I think Jess can put it in the chat, it's 949-251-0074. So I've got two boys at home who are in 6th and 8th grade, and just they would be unable to learn right now without their computer and without their internet connection. So we need to make sure that all California kids and all Orange County kids, no matter if there's a code, have that same opportunity now. And Dr. Aryaga, as you said, as we look at longer term, how do we address some of the systemic issues that we need to? So we're basically at the end of our time, and before we go, would just love to check in with each of you on any parting thoughts that you would leave for the audience at home, and also in the midst of all these challenges, kind of any sort of silver lining or any bright spots that you can see as we emerge from this challenge, and position California's and Orange County's education system to succeed and to thrive in the years to come. Dr. Weiss, I'll start with you.
Yes, first of all, again, thank you very much for the opportunity. I've really enjoyed the conversation, and for Dr. Hittenberger and Dr. Aryaga, you're amazing, so thank you. I would just add one thing to the last series of comments. When we think of health, all too often we think of physical health, but health really is a compilation of physical, mental, emotional, social. There are many components to health. And I think what we've seen here, to Dr. Aryaga's point, is that divergence of the haves and the have-nots. And unfortunately, we have still some room to address that. And I would also suggest that the lack of electronic availability for schools is somewhat translated also into the medical health side of things as well, because we've been doing a lot of telehealth visits, as you can imagine, nearly 55,000 since the middle of March. And if families don't have access to be able to go to school, they probably don't have access to be able to see a doctor via telehealth either. So those translate into multiple domains. As far as the silver lining, you're witnessing it right here. The opportunity for a traditionally clinical medical institution like CHOC, like UCI, to really be partnering side by side with the Orange County Department of Education. Dr. Maharis has been amazing. Christine Olmstead, their teams. We have such a great relationship now that we have each other on speed dial and we're texting all day long, and that's a good thing. And frankly, it should have happened a long time ago. But this is one of those silver linings where, where are kids? Kids are at school, they're in community centers, they're in places of worship, and we shouldn't be sitting in a hospital waiting for them to come to us. We should be partnering with the community and caring for them where they are. And this has been probably the major silver lining for us. So thank you again very much.
Oh, thank you, Dr. Weiss. Thank you for joining us, and thank you so much for everything you're doing to help our community in this crisis. Dr. Aryaga, your parting thoughts.
So, once again, thanks so much for having me today. And I remain ever hopeful that we'll use this moment to really change a system that wasn't working for all students before. I was in a conversation the other day, a panel with Ben McBride, and he called on us to say that he called on this to be a moment to have unrelenting courage and unjustifiable imagination. And I thought that was so important because there are some hard decisions we have to make, right? Or we might say, well, what does quality look like in education? We have to do it online in a hybrid. And it means we have to imagine it. Maybe it's something we haven't imagined before, but this is a moment where we can really break down those walls and do things like have small cohorts and individualized instruction, or maybe funnel funding in ways that we haven't before. And so, I remain ever hopeful, especially with this moment, that we'll partner with students, parents, and families to really create and have the courage to create something new that works better for all students.
I love that. Unrelenting courage. I love that. And Dr. Hittenberger.
I just want to echo what my fellow panelists have said, of appreciation for you holding this panel today. And it's just an honor to be a part of it and to be with these wonderful colleagues and with you. I would echo what they have said about partnership, courage, imagination. I think on the positive side of this, we have all been given a reminder of why community is so important. We need each other. This has weighed heavily on every single one of us. If we were carrying it by ourselves, we would have given up a long time ago. But we need each other. And this has pointed that out more than anything in recent memory, that every child in this community belongs to all of us. We're responsible for the health and well-being of every one of our fellow community members, wherever they might live in Orange County. And to be in that work together and moving the learning process forward for every child and making sure that health and safety are at the forefront of our work together is what we should always be about. But it's certainly what we need to be about now. And I'm heartened by the fact that so many have really put their hand to that work. And this kind of discussion, I think, advances that work. So thank you.
Well, thank you. And I want to thank all of you for joining us today for this conversation and for everything that you are doing for California and for California kids. And I think from my perspective, the challenges that we face certainly can seem incredibly daunting, but I do believe that this crisis has put a spotlight on systemic changes that we've needed to grapple with for a long time. And I believe that this crisis has also given us the focus, the will, and the commitment to actually do that work and get it done. And I think that what we all know is that ensuring that every California kid gets a good education, that's not just good for that child, that's not just good for that family, it's not just something we should do because it feels like it's a nice thing to do. We know that that is what we need to do to ensure the long-term growth, prosperity, and continued success of the state of California and of all of our communities. So thank you again for being here, and thank you. I'm so grateful to hear so much hope in each of you, and you know, we will continue to work with the experts to navigate this crisis and to ensure that we're able to build back California stronger than before. Thank you.